Hello everyone. As we age, our bodies no longer maintain the same health as when we were younger. One of the most vulnerable parts of our bodies to aging is our eyes. Most seniors face some eye problems such as blurred vision, dry eyes, macular degeneration, and cataracts. However, it is important to remember that early eye care can help prevent or slow down the process of vision loss. In today's video, we will learn about common eye diseases that seniors often encounter and simple measures to protect and keep your eyes healthy throughout your life. If you are in this age group, or if you want to take care of your loved one's eyes, don't miss the useful information below. Common eye diseases in the elderly and how to prevent them. 1. Cataract. Cataract is one of the most common eye diseases in the elderly and is one of the leading causes of blindness in the elderly. This is a condition in which the lens in the eye becomes cloudy, reducing the ability to transmit light into the eye and causing vision to become blurry, blurred, or difficult to recognize. Causes of cataracts. Aging. With age, the lens in the eye can gradually become cloudy, leading to a gradual loss of the ability to transmit light into the eye. Genetics. If someone in the family has cataracts, the risk of developing this disease is higher. Diabetes. People with diabetes are at higher risk of developing cataracts. Effects of sunlight. Long-term exposure to sunlight can damage the eyes and increase the risk of developing the disease. Prevention and treatment. Protect your eyes from the sun. Use sunglasses with UV protection to protect your eyes from sunlight. Perform surgery. Cataract surgery is an effective method to treat cataracts and restore vision. Get regular eye exams. If you notice blurred vision, get an eye exam immediately to detect the disease in time. 2. Macular degeneration. Macular degeneration is an eye disease that affects the macula, the central part of the retina, responsible for clear and detailed vision. This disease leads to loss of central vision, greatly affecting the ability to read, drive, and perform daily activities. Causes of macular degeneration. Aging. Macular degeneration mainly occurs in people over 50 years old and is a natural part of the aging process. Genetics. If someone in your family has macular degeneration, your risk of developing the disease is higher. Smoking and unhealthy diet. Smoking and poor nutrition can increase the risk of macular degeneration. Prevention and treatment. Nutritional supplements. Eat foods rich in vitamins A, C, E, and zinc, as they help protect the retina and maintain eye health. Avoid smoking. Smoking is one of the major risk factors for macular degeneration. Quit smoking to protect your eyes. Regular eye exams. Regular eye exams can detect the disease early, helping with effective treatment. 3. Glaucoma. Glaucoma is a disease in which pressure in the eye increases and damages the optic nerve. This disease can lead to permanent vision loss if not treated promptly. Glaucoma often has no obvious symptoms in its early stages, so people often don't notice it until it becomes severe. Causes of glaucoma. Genetics. If someone in your family has glaucoma, you're at higher risk of developing the condition. Aging. As you age, your body may have trouble regulating pressure in your eyes. High blood pressure and diabetes. People with a history of high blood pressure and diabetes are at higher risk of developing glaucoma. Prevention and treatment. Regular eye exams. Glaucoma may not have obvious symptoms, so regular eye exams are important for early detection. Maintain stable blood pressure and blood sugar. Controlling blood pressure and diabetes will help reduce the risk of glaucoma. Use eye pressure-lowering medications. Eye drops or oral medications can help reduce pressure in the eye, thereby preventing damage to the optic nerve. 4. Dry eye syndrome. Dry eye is a common condition that is especially serious in older adults. When the lacrimal gland does not produce enough tears, or when the quality of the tears is not good, the eyes will not be provided with enough moisture. This leads to a feeling of dryness, grittiness, and irritation. Causes of dry eye. Aging. As we age, the ability to produce tears decreases. The body's tear production system becomes less effective, causing the eyes to become drier. Dry environment. Air conditioning, dust, and strong winds can evaporate tears quickly, making the eyes more susceptible to dryness. Dry environments and electronic devices, such as computers or smartphones, can also increase dry eye. Medication. Certain medications, especially antidepressants, blood pressure medications, and diuretics can reduce the amount of tears, causing dry eye. Tear duct disorders. Certain conditions such as inflammation of the tear ducts or autoimmune conditions such as Sjogren's syndrome can reduce the ability to produce tears. Signs and symptoms of dry eyes. Gross sensation in the eyes. People with dry eyes often feel a gritty sensation in their eyes, as if there's a foreign object in their eyes. Red and itchy eyes. Due to lack of moisture, the eyes can become red, itchy, and easily irritated. This makes the patient feel uncomfortable and tired. Difficulty seeing for a long time. When the eyes are dry, reading, driving, or using the computer for a long time becomes difficult and uncomfortable. Temporary blurred vision. Dry eyes can reduce the ability to see clearly, making it difficult for the patient to recognize objects near or far. How to prevent and treat dry eyes. Use eye drops. Eye drops or artificial tears are the simplest and most effective treatment to help moisten the eyes. Patients can use them when they feel their eyes are dry. Protect your eyes from wind and dust. Wear sunglasses or protective glasses when going outside to avoid dust, wind, and strong light that can dry out your eyes. Maintain humidity in the room. Using a humidifier in the room helps reduce dry eyes, especially in the winter or when using air conditioning. Adjust your habits when using electronic devices. Take breaks to rest your eyes when using a computer, phone, or TV. Follow the 20-20-20 rule. After every 20 minutes of using electronic devices, look at something about 20 feet, 6 meters, away for at least 20 seconds. Drink enough water. Make sure your body is well hydrated. When your body is well hydrated, more tears will be produced and help reduce dry eyes. 5. Presbyopia. Presbyopia is an inevitable condition that occurs with age. It causes difficulty seeing up close, especially when reading, using a phone, or doing tasks that require close vision. Causes of presbyopia. Presbyopia occurs due to a decrease in the elasticity of the lens. The lens in the eye, which is responsible for focusing light onto the retina, becomes stiffer and loses its ability to change shape when looking up close. This makes it difficult to see objects up close. Signs and symptoms of presbyopia. Difficulty seeing up close. When reading, working on a phone, or doing tasks that require close vision, people with the condition will have difficulty seeing writing or small objects clearly. Feeling of eye fatigue. Having to adjust to near vision causes the eye muscles to work continuously, leading to a feeling of eye fatigue and tiredness. Holding objects farther away to see clearly. In order to see writing or objects close up clearly, people with aging eyes often have to move objects farther away. How to prevent and treat aging eyes. Wear reading glasses. This is the simplest and most effective method to correct aging eyes. Reading glasses help you see close objects clearly. Eye surgery. Some people may choose to have surgery to replace the lens or use LASIK surgery to correct vision. Improve eye health. Supplementing vitamins A, C, E, and zinc in the diet helps maintain eye health and slow down the aging process. 6. Uveitis, 1500 words. Uveitis is an eye disease that causes inflammation of the uvea, blood vessel membrane, which plays a role in providing nutrients to the eye. This disease can lead to serious vision problems if not treated promptly. Chorioretinitis can occur in one or both eyes and affect structures of the eye such as the cornea, iris, and retina. Causes of chorioretinitis. Infections. Infections caused by bacteria, viruses, or fungi can cause chorioretinitis. Herpes simplex and HIV can lead to chorioretinitis. Autoimmune diseases. Certain autoimmune diseases, such as Crohn's disease, rheumatoid arthritis, and lupus can cause chorioretinitis. Eye trauma. Physical trauma or damage from surgery can lead to inflammation in the eye, causing chorioretinitis. Genetics. Genetic factors can also increase the risk of chorioretinitis, especially if someone in the family has the condition. Gue Wai Kien Fan Hoi. Bang Ju Kien Ben. Kak Ban Dike De Tu Kien. Delu. Symptoms of cystitis. Redness and pain in the eyes. One of the most obvious symptoms is red eyes and a feeling of pain around the eyes. The pain can be persistent and uncomfortable, especially when you are exposed to bright light. Blurred vision and seeing halos around lights. Cystitis can reduce vision, and cause blurred vision, seeing halos around light sources. Tears. People often feel watery eyes or have a feeling of irritation in the eyes. Sensitivity to light. A common symptom of cystitis is sensitivity to light, photophobia, which makes looking in bright light very uncomfortable. Prevention and treatment of cystitis. Treatment of infections and autoimmune diseases. If the cause of cystitis is an infection or autoimmune disease, treatment with antibiotics, antivirals, or anti-inflammatory drugs will help reduce inflammation and prevent complications. Regular eye exams. If you have an autoimmune disease or are at risk for conjunctivitis, get regular eye exams for early detection and prompt treatment. Protect your eyes from injury. Wear protective eyewear when participating in activities that pose a risk of eye injury to reduce your risk of getting the disease. 7. Conjunctivitis. Pink eye, also known as conjunctivitis, is an infection or inflammation of the conjunctiva, the clear mucous membrane that covers the front surface of the eye. Although it does not threaten permanent vision, it can cause discomfort and fatigue for the sufferer. Pink eye can be spread through direct contact with infected eye fluid or a virus. Causes of pink eye. Viruses. Viruses such as influenza or herpes simplex are common causes of pink eye. Viral pink eye often causes redness, watery eyes, and itching. Bacteria. Bacteria such as streptococcus and staphylococcus can also cause pink eye. When infected, the eye becomes red and has a yellow discharge. Allergies. Pink eye can also be caused by allergies, especially to pollen, dust, or animal dander. Allergic conjunctivitis is often accompanied by itching and clear watery eyes. Exposure to chemicals or dust. Harsh chemicals or dust can irritate the eyes and lead to pink eye. Symptoms of pink eye. Pink eye. The eyes become red and easily irritated, with an itchy and uncomfortable feeling very common. Watery eyes. The eyes may water constantly, and there may be pus or mucus coming out of the eyes, especially in the early morning. Itchy eyes. People often have an itchy and uncomfortable feeling in their eyes, causing them to tend to rub their eyes. Feeling of foreign objects in the eyes. Due to irritation, the patient may feel as if there is a foreign object or something in the eyes, causing discomfort. How to prevent and treat pink eye. Keep your hands clean. Pink eye can be spread through contact with eye fluid from an infected person. Washing your hands frequently and avoiding touching your eyes can help reduce the risk of infection. Do not share personal items. Avoid sharing towels, pillows, eyeglasses, or makeup with someone who has pink eye to prevent infection. Use eye drops. If pink eye is caused by bacteria, your doctor may prescribe antibiotic eye drops to treat it. In the case of pink eye caused by allergies, antihistamines can help relieve symptoms. Treat allergic conjunctivitis. Avoid exposure to allergens such as pollen or dust. Using anti-allergy eye drops can help relieve itching and watery eyes. 8. Iritis. Iritis is an eye infection that affects the iris, the colored part of the eye. The iris plays an important role in regulating the amount of light entering the eye and controlling the pupil. Iritis can cause serious eye problems if not treated promptly, including reduced vision or even permanent vision loss. Causes of iritis. Autoimmune diseases. Diseases such as lupus, rheumatoid arthritis, and Crohn's disease can cause iritis. The body's immune system mistakenly attacks the body's own tissues, causing inflammation. Infections. Certain infections, especially those caused by herpes simplex and tuberculosis, can cause iritis. These bacteria and viruses attack the iris and cause inflammation. Eye trauma. Injury to the eye or damage after surgery can also lead to iritis. Genetics. Iritis can occur when there is a genetic factor in the family, increasing the likelihood of the disease. Symptoms of iritis. Eye pain. One of the main symptoms of iritis is eye pain, often accompanied by a feeling of suffocation in the eye and when looking at bright light. Red and sensitive eyes. Eyes with iritis will appear red and sensitive to light, photophobia, making it difficult for the patient to see in bright light. Blurred or reduced vision. Loss of vision or blurred vision is a common symptom in severe cases of iritis. Fatigue and headaches. Feeling tired and having headaches is the body's response to iritis when the body is fighting an infection. How to prevent and treat iritis. Treat iritis promptly. Early treatment is important to avoid serious complications, including vision loss. Treatment usually includes corticosteroid eye drops to reduce inflammation. Control autoimmune diseases. People with autoimmune diseases need to monitor and treat their disease to prevent iritis from recurring. Protect your eyes from injury. Wearing protective eyewear when participating in activities that pose a risk of eye injury can help reduce your risk of developing the disease. To keep your eyes healthy throughout your life, early detection and treatment of eye diseases is important. Common eye diseases such as cataracts, macular degeneration, glaucoma, dry eyes, pink eye, and iritis can greatly affect your quality of life if not properly cared for. Hopefully the information in this video will help you better understand common eye diseases and effective prevention measures. Start protecting your eyes today with simple habits and regular eye care to maintain healthy vision for a lifetime. Thank you for watching the video. Please share this information to help everyone protect their eye health. Don't forget to like, share, and subscribe to the channel to receive more useful healthcare videos. See you in the next video.